All right, guys, this is Dr. Rose, your family's chiropractor, bringing you that healthy edge. And what we're going to be talking about today is how to raise healthy kids. Now, this is going to be an awesome talk, workshop, seminar, whatever you want to call it, because what we're going to be diving into is our kids' current state of health, where it's at today, where it's going, how do we stimulate a healthy lifestyle, how do we fix current issues that our kids are struggling with, and a lot more information to go along the way. So let's jump into it just right off the bat. And first thing I want to talk about is just give you a little bit of information about me. I am married. That is my wife, Erin, right there. Those are our two dogs, Duck and Goose, or Double Trouble, or whatever you want to call them. They're a lot of fun. I am a Texas State kid, which is down there south of Austin by the river there. Awesome school. I went to Parker College of Chiropractic. That's where I got my doctorate of chiropractic and also my bachelor's in health and wellness. I am an epic pediatrics doctor. This is a group of doctors that are set out to change the world when it comes to pediatric care. Awesome group of docs. Look us up on Facebook if you ever have time. And I am the owner and doctor at Rose Chiropractic and Wellness here in Fort Worth. Now, to begin with, my why is definitely every single one of my patients. Yes, we do see adults. We love our adult patients, but we have a special place in our hearts for our kids that we see in practice. My passion is absolutely getting kids as healthy as they can be. And it's been a blast ever since we started treating kids, and it's just definitely something that I am on fire about. Now, where are we going to start with this talk? We got to start at our current state of affairs. Where are we now? Now, just specifically talking about the U.S., our kids are less likely to reach their 5th birthday than kids from other countries. The U.S. also has the highest infant death rate of any high-income country. Now, that last sentence should definitely scare you. Send some chills up your spine, because I know it did me the first time that I saw that. Now, we have the most technology in the world. We have the best health system. We have the best medical care on the planet. But for some reason, we also have the highest infant death mortality rate. That is super scary. Why is that? I think it has to do a lot with intervention. We intervene way too much. And we can't take something like the birthing process and make it become so mechanical, so medicalized. We've been doing this for thousands of years without 10 million ultrasounds and sonograms and all these different things. So really, I think it's just due to intervention. The next step that I got here is the percentage of U.S. kids and adolescents with a chronic health condition has increased from 1.8% in the 1960s to more than 7% in 2004. So that is quite a leap, just over a stretch of about 50 plus years here. And then also today, about 1 in 3 American kids and teens is overweight or obese, nearly triple the rate in 1963. Among children today, obesity is causing a broad range of health problems that previously weren't seen until adulthood. So on top of that, our kids are very overweight and they're unhealthy. That is mostly due to a lifestyle that we create for our kids. If they see us being unhealthy, they're just going to follow with whatever we're doing. Now let's jump into these chronic diseases that we're going to talk about. We're going to start off with asthma first, then go to allergies, and then talk about some ear infections too. Now, just starting off with these chronic childhood diseases and where we're at with them today, we've found that 12.8% of kids studied in 1994 compared with 26.6% of another group of same-age kids studied in 2006 had chronic health issues. So right there, that's pretty much double what it was in 1994 to 2006. And I guarantee you this number hasn't gotten better, it's gotten worse now that we're in 2015. So these chronic childhood diseases are definitely on the rise. 15 to 18% of American kids suffer with chronic illnesses, a number that is on the rise. So, and that's from a University of Michigan study. So when I talk about my patients, talk about their kids and where they are at with their health, you know, it's funny. Usually every single kid nowadays is suffering from something. It's very rare to have that child that's on no medication, is super healthy, is able to express themselves with no limitations. And that's our goal in this office, is to get children to be that weird kid in class. When I say weird kid, I want them to be healthy, but I want them to be to stand out from among their peers. Now, starting off with asthma, which we talked about. Asthma is a chronic long-term illness in which the airways become blocked or narrowed. This is usually temporary but it causes shortness of breath, trouble breathing, and other symptoms. If asthma becomes severe, the person may need emergency treatment to restore normal breathing. Now, this is a very, very scary thing. If anybody's ever had an asthma attack that's listening to this, or one of their children has had an asthma attack, it is very, very scary. It's nothing to joke about. It's a very, very serious condition. Now, why does this happen? What is the process behind this? So when the airways become in contact with one of these triggers can be any sort of allergen. It can be anything in the air that our body's immune system is not taking care of. The tissue inside the bronchi or in bronchioles becomes inflamed. At the same time, the muscles on the outside of the airways tighten up and constrict, causing them to narrow. Then the fluid, which is mucus, is released into the bronchioles, which has also become swollen. The breathing passages are narrowed still more, and breathing becomes very difficult. So basically, you go from airways that are nice and wide open to airways that are completely closed shut, and then you have this mucus that's in there too. So you think it's harder to breathe this way? Absolutely. Now, what triggers this? What causes this problem? So the symptoms of asthma are triggered by things in the environment, like I was telling you. These vary from person to person, but common triggers include cold air, excessive allergens, things that cause allergies, such as dust mites, mold, pollen, animal dander, or cockroach debris, and some types of viral infections. So we have these things that will trigger this process in our body, and the signs and symptoms of asthma are frequent coughing spells, which may occur during play at night or while laughing. It is important to know that cough may be the only symptom present, less energy during play, with the need of frequent rest periods to catch breath, whistling sound, wheezing when breathing out, complaint of chest tightness or chest hurting. So those are our signs and symptoms of asthma. Now, not every single kid has asthma, and I want you guys to really think about that. How come my kid or my child has asthma and other people's their children are completely healthy? Well, there's a difference there, and it really goes back to the immune system. If the immune system is healthy, it's able to take care of those triggers and get rid of them. If it's not healthy, those triggers stay in our blood supply, and then we get that asthma, or we get those asthma-like symptoms. So it's all about keeping the immune system healthy. How do you do that? We'll get to that later on in this talk. Now, our next condition that we're going to talk about is allergies. Allergies are a hypersensitivity immune reaction to a non-harmful substance. So this is usually allergens that are in the air. Now, what is the function behind these allergies? How does it all work? This is what this video is going to jump into.
Get your tissues ready because spring has sprung. Hey guys, Terry here for D News, and it is officially that time of year. The birds are chirping, the flowers are blooming, and if you're anything like me, your nose is a disgusting faucet of never-ending liquids. But before you go blaming pollen for those pesky seasonal allergies, remember, you have no one to blame but yourself. So what's happening inside your body when you experience allergies? Well, in short, it's basically one giant misunderstanding. The first time you're exposed to an allergen, your immune system investigates that allergen and produces specific antibodies for it, which are special cells designed to detect and stop foreign invasion. Typically, this is a good thing. It's what prevents you from getting sick. But in the case of allergies, your immune system mistakes innocuous things like pollen or cat dander for a serious threat. And in response to that threat, your plasma cells release a flood of these antibodies that attach to the surface of your mast cells, causing them to burst open and release a flood of histamine. Histamine is what causes the swelling that leads to various allergy-like symptoms, like runny nose, sneezing, or hives. But why do some people have such bad allergies and others none at all? There's no cut and dry answer to that question, but genetics and environment seem to...
Okay, I'm going to stop it right there. So there is a reason why not every single person has allergies. It's due to the immune system. If people's immune system is functioning properly, if your child's immune system is functioning properly, they will not have allergies. So the body's response to an allergen coming in is the immune system recognizes that, kills it, gets rid of it, and you never know anything went on at all as far as attacking your body. And that's the role of the immune system. Now, here is the process. An allergen enters the body through the skin, lungs, or bloodstream. The body recognizes the allergen as an invader and sends antibodies to attack it. These antibodies or whiter blood cells release histamine to stimulate the body's ability to get rid of the allergen. This is your runny nose, your sneezing, your watering eyes, and in children, this is rashes. Rashes are just another way of your body trying to push out an allergen or a bacteria and get it out of its system. So this is your histamines part. This is why every single thing that we take, if you have allergies, is antihistamine. This is your Zyrtec and all those type of things. So what we want to do is we want to stop this process at the very beginning. We want your body to recognize that allergen and it push it out automatically, not to get to this secondary process where it's having to release histamines. Now, typically when we get allergies, what do? Well, we sneeze. So let's check this out. Okay, so very cute video there of the kids sneezing, but that's our body's natural reaction to allergies coming in. It sneezes, it gets them out of there. Now what happens is we start taking Zyrtec and all those antihistamines, and it blocks this process from actually taking place. So are we actually fixing our allergies when we take those things? No, not at all. We're just covering up symptoms, okay? What we're doing is we're stopping our body's natural ability to get rid of that allergen. So very important that our body is able to sneeze and go through these processes to get rid of these allergies. Now, what are the signs and symptoms of allergies? Skin rash or hives. Remember, this is more prevalent in children. Coughing, sneezing, itchy eyes, dark circles underneath eyes, which you'll see this a lot in kids too. Runny nose, trouble breathing, or wheezing. So those are your signs and symptoms of allergies. And what is it all linked back to? It's all linked back to if the immune system is working properly, you will not have allergies. Okay, so what's the next thing we're going to get into? It is ear infections. So what is an ear infection? Middle ear infection, or otitis media, is an infection that occurs behind the eardrum, in the middle part of the ear. Middle ear infection is the most common childhood illness treated by pediatricians. This is the most common childhood illness treated by pediatricians. Okay, so are they prevalent? Heck yeah. 75% of all kids will have at least one middle ear infection before the age of 3. So, super important that we tackle this. Okay, 75% of kids suffer from ear infections. Now, here's a good visual of where that ear infection builds up. It's right there behind the eardrum in the middle ear. That's your otitis media. That's where your fluid's going to build up. There's your eustachian tube where that fluid is supposed to drain. Sometimes that'll close up if things aren't working properly. And that's what we're going to jump into next. How does this ear infection start? Where does it happen? So the tensor veli palatini, that's an Italian muscle there, is innervated by the medial pterygoid nerve, a branch off the mandibular nerve, the third branch off the trigeminal nerve. Actions, what does it do? It is associated with both mastication, which is chewing, and with opening of the eustachian tube through its function of tensing the palate. When the TVP, or tensor veli palatini muscle, does not get the correct nerve flow, it begins to malfunction and close the tube. So what happens is this TVP muscle does not get the correct nerve supply, it starts to malfunction and it will not open that tube. When that tube is closed, fluid starts to build up. Then what are you left with? Well, you're left with a swamp, right? And swamps are full of bacteria, nasty fungus, all sorts of nasty things. Well, that's what's pretty much is what an ear infection is, okay? Fluid gets infected, it builds up, it starts hurting. There's your ear infection. Now, what are the signs and symptoms of an ear infection? How do we know that our kids might be having an ear infection? Well, at first, I'm going to bring this down just a little bit here so we can see that. So at first, your child may have the sniffles with clear runny fluid in the nose. Okay, clear runny fluid is what they start out with. Nasal stuffiness or congestion may come next, marked by thicker yellowish mucus. Some kids have a low-grade fever. Sore throat is common. Your child may develop a cough. So really, what are we getting at? Ear infections usually start off just by symptoms of a cold. So if your child is going through symptoms of a cold, they might be dealing with an ear infection too. Now remember, how does that ear infection occur? It's from that TVP muscle not getting the nerve supply that it needs to open up that eustachian tube. So how do we get that muscle the correct nerve supply? That's what I'll be going into here in just a sec. So last but not least, we need to talk about this. It's our neurodevelopmental disorders. This is our ADHD, our autism, and our sensory processing disorder. So ADHD, where does that start? That's 1 in 9 kids, 1 in 12 boys. It's the most common drug prescribed in the same class as cocaine. Very, very powerful, scary stuff. So this is your Ritalin, your Adderall, your Concerta. It's in the same class as the cocaine. We're dealing with very powerful drugs that we're treating this stuff. It's not like taking vitamins, okay? And then you have your autism, which is 1 in 68, more common in boys. 2 decades ago, this is 1 in 2,000. What the heck is going on? How come this is becoming more prevalent? Well, autism is not due to just one thing. It's actually due to several different stressors that build up in our child's body to present with autism. So it's not just due to one thing. And then our sensory processing disorder is now 1 in 20 kids. It can vary from one symptom to a variety of symptoms there. So just starting off with ADHD, here's just a cute little cartoon that I found. What do we want? A cure for ADHD. When do we want it? Squirrel. So just something to get a little laugh there. Okay, getting serious. ADHD, is it a disease? Is it just crossed wires? Is it a mental disorder? Or is it a chemical imbalance? You know, that this last one here is probably more accurate than any other thing. It's a chemical imbalance in our body. And what happens is, with ADHD, you have your nerve synapse, which is the end of nerve. This is your brain tissue, okay? This is where the nerve and brain come together. And what's going on is the nerve here is trying to release this serotonin, this dopamine, and what's happening is the brain is not able to absorb it fully. Now, before the chemicals get to the brain, they're getting reabsorbed by the end of this nerve here. So what happens is there's a chemical imbalance in the brain due to the nerve synapse reabsorbing, okay? So it definitely is a chemical imbalance. Now, what controls your brain, what controls the nerves, all of that is due to your central nervous system, okay? So there definitely is a chemical imbalance, but there's better ways to treat this than just throwing drugs at it, okay? So what are the signs and symptoms of ADHD? Now, inattention first. Pays little attention to details, makes careless mistakes, has short attention span, does not listen when spoken to directly, does not follow instructions, fails to finish tasks, has difficulty organizing tasks, avoids tasks that require sustained mental effort, loses things, is easily distracted, is forgetful in daily activities. Now, keep in mind we're talking about kids here. I even have some of these going on. So ADHD is not something that's very hard to diagnose. I think it's being abused a little bit, especially when you have this many things going on that as adults we all suffer a bit with. And then there's the hyperactivity side. Fidgets, squirms in seat, leaves seat in classroom when remaining seated, runs about or climbs excessively, has difficulty playing quietly, acts as if driven by a motor, talks excessively. And then there's the impulsivity there. Blurts out answers before questions are completed. So I'm sure no one's ever watched Jeopardy that's listened to this and blurt out the answer when you knew the answer. So some of this stuff is very easily diagnosed. And keep in mind, the majority of kids being diagnosed with ADHD now are under the age of 5. Okay, under the age of 5, are they going to be able to sit for long periods of time? No. Are they going to get up, like to run around and do things and talk excessively? Absolutely. So the ADHD diagnosis system definitely needs work, and it's something that gets abused a little more than it needs to be. Okay, autism. What is autism? Autism spectrum disorder, ASD, and autism are both general terms for a group of complex disorders of brain development. These disorders are characterized in varying degrees by difficulties in social interaction. verbal and nonverbal communication, and repetitive behaviors. So with autism, it's not due to one specific thing. It's actually a collection of different types of stress that will present itself as autism. This can be really bad birth trauma. It can be vaccinations. It can be medications. It can be problems in development as well. So several different things will cause autism. And now what I do is, as a chiropractor, when we have a patient that has autism, is we try to basically get stress off of their nervous system so they can function to the best ability that they can. Now, what causes autism directly? I jumped ahead of myself a little bit there, but we don't know. There is no specific cause. It's an algorithm. It's several different things that can present autism. Now, what are the signs and symptoms of autism? Not responding to their name by 12 months of age, not pointing at objects to show interest, not able to play pretend games, avoiding eye contact, having trouble understanding other people's feelings or talking about their own feelings, have delayed speech and language skills, repeat words or phrases, give unrelated answers to questions, get upset by minor changes, have obsessive interest, they'll flap their hands, rock their body, have unusual reactions to the way things sound, smell, taste, look, or feel. So we have some major issues, especially in the central nervous system with autism. And as a chiropractor, especially a pediatric chiropractor, what we do is we strive to getting rid of interference in these kids' systems so they can live the best possible life that they can live. Okay, so our last one here, sensory processing disorder. SPD is a condition that exists when sensory signals don't get organized into appropriate responses. Pioneering occupational therapist and neuroscientist Agene Aries likened SPD to a neurological traffic jam that prevents certain parts of the brain from receiving the information needed to interpret sensory information correctly. A person with SPD finds it difficult to process and act upon information received through the senses, which creates challenges in performing countless everyday tasks. Motor clumsiness, behavioral problems, anxiety, depression, school failure, and other impacts may result if the disorder is not treated effectively. So what's going on is there's a problem in the sensory system. It's not getting to the brain properly. And that's what this video is going to go through and show you what I'm talking about here.
Some kids are really bouncy and can't sit still. Some kids aren't very coordinated. Some see food as a pile of toxic goo that hurts their mouth and jangles their taste buds. School might be a mysterious place where things don't make much sense. If this sounds like you, you may have sensory processing disorder, and we're going to explain it here. Your body has 7 senses: vision in your eyes, hearing in your ears, touch in your skin, taste in your mouth, and smell in your nose. And you have 2 movement senses: your muscles and your sense of balance. In sensory processing disorder, these senses don't communicate right with your brain. Think of the nerves connecting your brain and senses as a set of roads. Those roads should be smooth superhighways so that the senses and brain can communicate fast. If you have sensory processing disorder, then some of your roads are bumpy and rough. You can also think of the senses as having a broken volume control. If the volume is too high, you will feel your senses too strongly. If the volume is too low, you won't feel sensation at all. In fact, you'll want more. Some kids overcome these problems as they grow older.
Okay, so that's sensory processing disorder. What's going on is there's a problem in the senses. They're not getting to the brain correctly. There's a problem in that nervous system. So what are the signs and symptoms of this? Hypersensitivities to sensory input may include extreme response to fear of sudden high-pitched, loud, or metallic noises like flushing toilets, clanking silverware, or other noises. This can be like a car horn, something along those lines. May notice or be distracted by background noises that others don't seem to hear. Fearful of surprise touch, avoids hugs and cuddling. Seems fearful of crowds and avoids standing in close proximity. Doesn't enjoy a game of tag or is fearful of swings and playground equipment. Extremely fearful of climbing or falling, even when there is no real danger, has poor balance, and may fall often. Hyposensitivities may include a constant need to touch people or textures, even when it's inappropriate, doesn't understand personal space, clumsy, uncoordinated movements, an extremely high tolerance or indifference to pain, often harms other children or pets because they don't understand their own strength, may be very fidgety and able to sit still, seems to be a thrill seeker, can be dangerous at times. So there's a problem with our sensory system here. Either we're hypersensitive to things or we're hyposensitive to things. Now, what can we do to help this? So what can we do to help a child that's facing these chronic childhood disorders or diseases? So a lot of these things can be related to a couple different things here. And a lot of them have to do with some simple changes that we can do. First and foremost is we can start with diet. Here is a great diet for kids suffering with any type of sensory processing or ADHD. Studies suggest that hyperactivity and learning problems can be due to a lack of vitamins and minerals, as well as from red dyes and preservatives in food. A great diet to look up is called the Feingold diet that removes all sorts of red dye and all preservatives from our children's diets, and kids really benefit from this. Reports also show that children avoiding dairy, wheat, corn, soy, citrus, egg, chocolate, peanuts, artificial colors, flavors, and preservatives for 2 weeks reported considerably less hyperactivity and improved attention. So everybody knows it. You know, you're putting crap in your body, you're going to get crap out. So really pay close attention to what you're feeding your kids. If you want them to be as healthy as possible, this is a huge area that you can improve. Okay, just staying along those lines, dairy. Dairy is so bad for kids. Why? Because it clogs up their immune system. If you have a kid that's suffering from allergies or asthma or even ear infections, get rid of dairy. The less dairy, the better it'll be for your children's health. So the overconsumption of dairy products, cheese, yogurt, milk, is very harmful to a child's system. Dairy tends to clog up our immune system, intestinal system. 70% of our immune system lives in our gut. So 70% of our immune system is there. And if you're throwing dairy constantly on that immune system, it's not able to work properly. So this is an easy fix. Try and get rid of that dairy, and it will at least help with some of the symptoms that your kids are getting. And the last part there is physical activity. Got to get our kids to get out and play and actually get their bodies in a state of where their bodies can relax and just worry about function. So physical activity is a huge part of that. There's a big push right now going on in the government where they're advising at least 60 minutes of play for our kids outside doing some type of exercise or physical activity. So this is a no-brainer. Get your kids out there, get them active. Now, essential oils, too, play a huge role in our children's health. This is pretty easy. These are something that are becoming really, really popular nowadays. And here's just the top 10 essential oils for children's health. So number 1 is tea tree oil. It's an antibacterial, antifungal. You can use this on cuts, scrapes, burns, even ear infections. It's a great oil to use. Now, lavender oil is a great oil for just overall immune system health. It's also used to calm or soothe sunburns. And the last one there is chamomile oil. I don't know if I'm saying that right, but it's an anti-inflammatory sedative. It's used for colic, ear infections, and also to help calm. Peppermint oil. This is great for headaches. It's also really good for colic and fevers. Eucalyptus oil. You can use this again for any type of antibacterial things, congestion, especially in the sinuses. Rose otto oil. It's anti-inflammatory. Citrus oils, okay, this is your orange, your lemon, your grapefruit, and all those. You can use those to energize or help to calm. Frankincense is a really good oil for antibacterial. Also, with people suffering from cancer, this is a great oil too to use for that. It's also used for mild wounds and sinus infection. Sandalwood oil, antibacterial, anti-inflammatory, sedative. That's a great oil. St. John's wort oil is really good for earaches and also just nervousness and anxiety. Okay, so those are some really good essential oils that you can use. Now, we have oils, we have diet, we have physical activity. What's the last thing that we need to make sure is working at its absolute best? Well, you know what? It's our nervous system. Now, in Grey's Anatomy, this is not just a show, right, full of sexy doctors and their problems. It is actually a book that every single medical student, chiropractic student, physical therapy student, you name it, this is our Bible. Well, in Gray's Anatomy, it says, the nervous system controls and coordinates all functions of the body. So what do we mean by that? Controlling all functions of the body. Well, we mean this. You live your life through your nervous system. If there are problems in your nervous system, guess what? Your immune system is not going to work. What asthma and allergies and ear infections all have in common? It has to do with our immune system not functioning properly. Well, guess what? Your nervous system controls that. So it all starts at the nervous system. And you can see our autonomic nervous system chart here. It goes to show you exactly where these nerves are coming from. They innervate every single muscle organ tissue in our body. And if these nerves are not able to communicate with these organs here, you're going to start to have dysfunctioning there. So we really need to make sure that our nervous system is working properly. Okay? So what do we call it when our nervous system is not able to communicate to other cells or other organs in the body? Well, we call that a subluxation. Now, subluxation, it comes from 3 different types of stress in your life, or even in your child's life too. It's going to come from physical stress, which is your childhood falls. Your birth trauma is a big one. When we say birth trauma, we're talking about C-sections, we're talking about forceps delivery, we're talking about vacuum delivery. Now, those are things that will put a lot of trauma on your child's health, and that'll create a subluxation in their system. And the last part of that is mental health there. Mental health is huge, especially with kids that have to go to the NICU when they're born. They need to be with their mom, getting that touch, and in the NICU, they're not allowed to be touched. So that's going to put a lot of mental stress on them. And one more part of that is chemical stress. Vaccinations, bad food, bad water, medications, they create stress in our body and will create that subluxation. So what that subluxation does is it creates a small misalignment which starts compressing on nerves, and whatever muscle organ tissue that nerve is going to is not going to get the correct nerve supply. It doesn't know what to do. It starts to malfunction. When it starts to malfunction, you get that dis-ease in your system. That's when you get those symptoms that can occur. That's why every single person should be checked for subluxation so that we can make sure that they're functioning properly. Here's just a good visual of what a subluxation looks like. Let's say you have a garden that has irrigation or even pipes or hoses going to the plants there. If you have free-flowing pipes, you're not going to have any issues with those plants getting the water that they need. They're going to be nice and healthy. Well, what if you have partial blockage there? If you have partial blockage, you're not going to have a plant that's 100% healthy. You're going to say maybe 60% function there in that plant. So what happens if you have no nerve supply at all? Plant dies. Okay? So this goes to show you just what subluxation will do in your system. If you don't have any subluxation whatsoever, your body will be functioning at 100%. If you have some subluxations, maybe 60 to 70%. If you're full of subluxation, it's completely cutting off that nerve supply, you're dead. Okay, that's what it is. Now, some really cool things I want to show you guys along with this is a study that this guy named Ronald Perot did back in 1986. He is a chief of cancer prevention research at New York's Preventative Medicine Institute. So this guy doesn't mess around. He knows what he's talking about. Well, he did a study where he took 3 different groups of people. First was a group of people who have been under regular chiropractic care for 2+ years. Then he took the next group of people who were not under chiropractic care, but they were deemed healthy. The last group there were people who were sick, had cancer, had serious illnesses there. Now, what he found going through this study and his research is that chiropractic patients had a 200% greater immune competence than people who had not received a chiropractic adjustment, and 400% greater immune competence than people with cancer or serious diseases. So does chiropractic help boost your immune system? Absolutely, absolutely, heck yeah. So he says chiropractic may optimize whatever genetic abilities you have so you can fully resist disease. So that goes to show you the power of chiropractic care. Help strengthen that immune system so you're not dealing with these things like your autism and your asthma and your all these type of neurodevelopmental disorders and your allergies and all these things that our kids go through and suffer with. Okay, so what do I do in my office to really get specific and test and see what we can do for these kiddos? Well, number one, we don't guess, we test. And how do we test? We use our scans, okay? This is an awesome piece of equipment that we use to tell what's going on with your children's health. Now, as you can see down throughout these pictures, it shows us what issues may be going on, and it's really cool stuff because it serves as a great visual aid, so you can see where that subluxation's at, and the doctor can see where he needs to fix that subluxation. And as far as ADHD goes, what we have going on there is we have a nervous system that's out of control. We have a nervous system that is a Ferrari screaming down 35 with no brakes. And what do we want to do as a chiropractor? We want to slowly tap the brakes on that nervous system so we get them back to functioning where they need to be. Now, just a couple testimonials here of patients in my office. What I first want to start off with is Miss Caitlin. Now, Caitlin had severe allergies. She was on Zyrtec every single day, constant runny nose, history of ear infections, not a very healthy kid. Now, this is her first initial scan when she came in to see me. Now, white is what you want to see. Green is a mild subluxation. Blue is a medium subluxation. Red is a severe subluxation. So what do we have here? A lot of subluxations down throughout her lower nervous system. Now, these nerves go directly to your gut. Remember, 70% of your immune system is in your gut. So what do we have to do with Caitlin? We had to get rid of these subluxations going throughout her gut. Once we did that, this is her next scan. Just a few short months later, 2 months later to be exact, she's completely clear in the middle. She's still got a minor subluxation there and there, which we need to make sure that we clear up because we don't stop until we get absolutely healthy there. But is she still taking Zyrtec? Heck no. Is she be able to go out and play and not have ear infections and runny nose and all those type of things that she was struggling with? No way. She doesn't have any of that stuff going on. So this goes to show you what chiropractic can do. Just removing that subluxation, allowing her body to heal itself. No more medication. All right, the next patient I wanted to share you with is Max. And Max is an awesome, awesome kid. He had severe birth trauma that led to having really bad eczema. Now, what's eczema? Eczema happens when your immune system is not working properly. Okay, it's your body's way of telling you the immune system is not working properly. It's like a rash is what it is. Now, when Max first came in to see me, this was his first scan. We had several subluxations up top and some right there in the middle of his upper back. As we went through the adjusting process just a month later, this is where Max was at. Okay? No more medication, no more eczema, no more issues, okay? His nervous system has come back online. He's got some minor subluxations through there, but doing so much better. You can see from his pattern here, he goes from a crazy out of whack pattern to a pattern that's just in line where it needs to be. All right, so I'm sure some of you watching this are wondering if my child has subluxation, or wondering if, man, possibly I could help your child out. Well, that's what we're doing here. We're giving you a chance to find out if your child has subluxation. And this is a serious, serious thing because our child's state of health is not getting any better. How can we turn that around? We'll at least get them checked in our office. And one of the really cool things that we're doing in our office for a short period of time is we're giving you, your child's health a serious look, and we're going to do that for $40. And that includes your child's report of finding as well. So I'll sit down with you, get a great history, very in-depth. We'll scan them. We'll get that scan just like Caitlin and Max had, and we'll see what's going on with your child's health. And I'll let you know if it's a chiropractic problem or not. Now, to get that $40 first visit, you have to call us, and you have to give us that key phrase, I want a healthy child. If you don't give us that key phrase, that first exam goes up to $120. So let Lynette know up front that key phrase is, I want a healthy child. Get your kids scheduled, get them in, see if they're subluxated, and so we can get them started on a healthier lifestyle. And thank you so much for listening to my presentation. This is Dr. Rose giving you that healthy edge. Can't wait to see your child.